me? Is my audio working now? These are good questions, you guys. I appreciate that. Lucy, I did end it and went back. I'm back on YouTube. Can you go over there and see if you can hear? In the meantime, are there any questions on my Instagrammers in regards to protein? Is there any, questions in regards to fat, timing of protein? If you're wanting to know an exact amount of protein, okay, it's better. Okay, great. Thanks, Heidi. I appreciate it. Heidi's over there on YouTube. We signed out and signed back on. So if you have any questions, please don't hesitate to ask. We can go another 15 minutes if you like. What causes, wait. Heidi, are you overweight and you have these boils? Because it sounds like what you're describing is hydradenitis. Hydradenitis. It's very common it's usually in striae, so stretch marks. So it's very common under our arms, under our breasts, in our groin, in our pelvic region, and sometimes in our butt crack, as you call it, cleft. It's very common on our buttocks. So hydradenitis, they're very painful. They're usually bluish red ulcers. You don't think you're overweight? You could still have hydradenitis. I don't know, but that is a possibility. Oh, you were diagnosed with that. Okay, so even though you're not overweight, you can still have that. I'm sorry. It's common during pregnancy too. So you might have developed it during pregnancy if that fits your description. So, but hydradenitis, I've had people get surgery for hydradenitis, and I think there's other things that you can do. All right. And Dr. Christie, we gave your information out earlier. I don't know if you're still here on Instagram, but we gave your information out earlier. So you might get some people contacting you in regards to glucoferrin and iron. So I told them about your website, Metabolism IQ. Oh, okay, you're here on this site. So Dr. Christie, I did give your information, okay, to people who wanted to know more about glucoferrin and the ability to chelate, sequester, and bind iron, non-heme iron. We got into a deep discussion on non-heme iron from plants and from supplements as well as processed foods. So obviously I am back on YouTube. So we can go another 15 minutes, 14 minutes, but if there's no further questions, we can. Yes, Aura, I am a doctor, family practice. I'm in the United States. Okay. Well, if there's no further questions, we can call it quits. NM, thank you for joining. But we've been live here. What do I practice? It's family practice. What is the best way to get your iron if you have leukopenia? So your leukocytes are low. Usually white blood cells and red blood cells walk a linear line together. When the red blood cells are not healthy, usually the white blood cells are not healthy. Could that result from poor stem cells? It could. But again, I would look deeper into your iron studies, get a ferritin level and a transferrin level, and get a TIBC and get an iron saturation. These are important. Getting an iron, a serum iron level. These are important. Getting a CMP and a CBC. We need all of these labs in order to get a good picture of what's going on. Okay? Just simply having your hemoglobin say that you have low hemoglobin and you have low white blood cells. There is a reason why your white blood cells are low. Heidi, you have CHF. What was the diagnosis? Aura, if you're having trouble with being too skinny, maybe you want to consider a consult, and we can delve into a plan of action for you in regards to diet and exercise, your sleep patterns, your other lifestyle patterns. We can go over everything in detail. So if you want to email me at IronLadyDoc@AOL.com. Michael says, is 35 okay to check for colon cancer? Any age, Michael, is okay to check for colon cancer, but the chances of it getting more prevalent is as we age. Now, if you have a family history of colon cancer and you want to check it at 35, I think that's a great idea. But you also have to know what you're going to do with that information. There's a lot of people that will do, the DNA testing for colon cancer, or they'll do the GRAIL test, which, looks at a whole bunch of cancers. These are what you just have to know what you're going to do with it. If you get an answer back, what are you going to do? If Michael at 35 wants to do a Cologuard and check DNA, if it comes back positive, then advance to a colonoscopy, great. But Michael, I'm guessing that unless your insurance approves you at 35, they will not approve you for a colonoscopy at age 35. 45 is the cutoff for getting paid for by insurance, unless you fit into their criteria. So you need to talk to your insurance company, even with the Cologuard. Heidi, I don't know what could be going on, but I would be happy to consult with you in regards to go over everything. But I'm glad that your heart function is fine. I'm guessing you had an echocardiogram and your ejection, your EF, was high. Hopefully it was in the 60s. But I remember one doctor it was a cardiologist who told me that a person was complaining of lower extremity edema and swelling. Edema is swelling. And it was greater on one side than the other. And this, I will never forget it. I was on a bus with them. I don't even know where we were going. And it was a doctor giving a lecture. I know, right? On a bus. I don't remember where we're going, but this will always stick. He goes, if I see something where the edema is higher in one leg than the next, I'm checking that person for cancer in the pelvic area. And that has always stuck with me. So Heidi, check for cancer in your pelvic area. Ask your doctor to get an ultrasound or a CT scan. Can you buy a new PC? Not Beetle. If you want to buy yourself a PC, go for it. I do not help people spend their money. Okay. Mike, I don't have an opinion on those two teams, but I did watch the BYU game last night, and that was pretty incredible. If you have a medical question, let me know. I wasn't diagnosed. The doctor just said it wasn't that and left it. Well, I would definitely get the results of your echocardiogram. You want to know what your ejection fraction is. How can I send you a donation? Millionaire, you can there's a little heart in the comment section where you just wrote this comment. I believe it's to the far right. There's a little button and it might have a little $ in it. You can push that and send a donation. On the description, I put in a donation to PayPal. It's a link to my PayPal donation site. That's how you can send a donation. On YouTube and for Instagram, the link is also in Instagram for the PayPal donation. Thank you, Lolly. That's important to know about creatine and your ability to increase your digestion. But a lack of creatine likely tells me that you have a low amount of protein from meats coming in. So people who have low creatine likely are not eating a meat-based diet. Yeah, Heidi, it sounds like you might want to consider a consultation so we can go over things. You know, Timmy, my nurse always used to say that. She would look at people's hands and go, oh my gosh, you have great veins. If you feel that you do not have a very good digestive system and are always bloated, constipated, and have stomach pains, then as well as constipation, I think you should do an elimination diet. I would consider eating meat, salt, and water for 30 days and see if your digestive system, but likely you are consuming a high plant diet and the bacteria are fermenting all of the crapola that you're putting into it and causing all of the stomach pains, gas, bloating, and constipation. Yes, I believe in God. Thank you for asking. A well-known doc needs a donation. What is the creatine blood test? It's the creatinine, BUN and creatinine. It's for your kidney function. You want an estimated GFR as well. The best test is to check a urine microalbumin. I'll be right there, girl. Tootie's got to go to the bathroom, so I'll make this quick. Getting a cystatin C, cystatin, as well as a urine microalbumin is the best kidney function test that you can get. Hi, Logan. Thanks for joining. Patriot, I don't know why they hide mycosis. Fungal infections are very common. They eat the exact same things that bacteria eat, or viruses, or parasites. Fungus, yeah, very common. They love iron too. Iron and sugar. That's what fungus loves. You know, the Half Hawk says, what are the earliest symptoms of kidney failure? Unfortunately, we don't know. You don't feel it. You don't have symptoms until it's too late. And then you'll know it. You'll be in the hospital. ACL recovery advice, go to physical therapy. Go to physical therapy. Low carb diet to decrease the inflammation in your body. High protein diet. Much protein and much fat. That will help your recovery much faster. But go to physical therapy. Talk to your physical therapist. Not about diet though. Just about exercises. Patriot, I can't remember what you're talking about. Hey, doc, I have left chest pain and acid reflux. Doc says it's caused from stress. Sounds like you might need to, and they put you on antidepressant. I'm guessing that was a 5-minute visit with them. I think you should probably find a different doctor and go over why you have acid reflux. And if you would like a consultation to gather up all of the information, and then you can take it back to your doctor, sometimes that helps. So you can email me at ironladydoc@aol.com. IRON, iron, lady, LADY, DOC, ironladydoc@aol. Cycling helps us exercise. Well, as long as your seat is not too low. If you are cycling and your seat is too low, you're putting a lot of knee a lot of knee flexion. And a lot of people, a lot of doctors will not tell you that you need to elevate your seat, but I probably would not cycle, but that's up to you. Oh, the fungal infections are a racket, you're saying, Patriot? Is naproxen sodium safe for arthritis pain relief if one has high blood pressure? Half Hawk, you need to find out why you have high blood pressure. Why are you simply taking a medication for your arthritis when you have high blood pressure? Your arthritis and your high blood pressure are likely caused by the same thing. High carb diets that spike insulin. Insulin causes water and salt retention, which leads to high blood pressure. And because insulin is high, sugar is high, you're very inflamed, so you're causing a lot of arthritic problems, as well as the cartilage degeneration. Good, but why are you stressed, Abhil? You're taking antidepressants, but why are you stressed and anxious? Okay. All right, you guys, we will end there. We will be back, Lord willing, next Saturday at 9 a.m. Central and Sunday at 10 a.m. Central. Please like and subscribe, share this information. I would really appreciate it. And we'll go from there. Follow me. I have reels almost every day. I will do a topic. If you want to go to my store, it's on Fourth Wall, and there are links in the descriptions. I think that's it. Remember, this is not medical advice. It's for information purposes only. So you guys have a blessed Sunday. See ya.